Boston's Mayor Michelle Wu is our guest this morning. Let's go on the record. She's a mayor in motion, swearing in the city council, distributing COVID test kits, touring the shuttered Long Island Treatment Center, all in a week. There's lots to talk about, so let's go on the record.
From WCVB Channel 5, the inside word from Washington to Beacon Hill. Today's newsmakers are going on the record.
Welcome to OTR on this Sunday morning. I'm Ed Harding, along with News Center 5's political reporter Janet Wu. The surge in COVID-19 cases means, as you can see, that we have returned to our social distancing protocols back here on the set. And our guest this morning is joining us via Zoom. The mayor is not in studio with us. She's on Zoom. Boston's Mayor Michelle Wu took the oath of office back in November. And to say the least, her plate has been full since then. Madam Mayor, thank you so much for joining us. It's great to see you. Happy New Year, by the way.
Happy New Year. Great to be back.
Thank you very much for joining us. Let's start with Omicron. You handed out free COVID tests around the city, but ran out. You're trying to shorten the testing lines, but people are still out there waiting hours. Can you offer any hope that this will change anytime soon?
You know, we are still very much in the middle of the pandemic, and that means we have to keep closing vaccination gaps and keep putting resources towards testing. We've already opened up new testing sites in the city of Boston, new walk-in sites just in the last week. We have more on the way. We're working on a high capacity site, and this is so that everyone can stay safe. We also know that what Boston has been doing has been working. We've been identifying more cases of COVID-19. We've been increasing our vaccination rates, including the percentage of residents who are boosted. So we have to keep at it. This is really the most powerful tool we have to end the pandemic.
You are delivering vaccines at Fenway. Any chance of getting testing added to Fenway?
We are exploring having joint side-by-side vaccination and testing in the places where that has been happening. At Tufts Medical Center, for example, it's been very successful. And in more and more of the city sites, I think we will be moving in that direction as well.
Any idea how soon that could happen, like within the next week or two, or probably a little longer?
We're working hand in hand with the state. The state is actually operating the Fenway site in partnership with the city. And so there's some moving pieces, but I know that the state is continuing to invest in making testing more accessible as well. So we're doing our part to manage those lines, get people quickly in and out. And especially as the weather gets cold, just realize that everybody has a lot on their plates. We need to make this as efficient as possible.
And one of those things, Madam Mayor, obviously is going back to school and educating our young people. So over 1,000 Boston teachers and staffers, not just teachers, but staffers and elsewhere, clerical work, everyone that is in the infrastructure for school, was unable to show up for work last week. So how do you manage getting students to school and then teaching them in what is obviously a chaotic time, and the chaos may last for at least a couple of weeks ahead?
Our classrooms are truly a reflection of what's happening out in the community. And so when the COVID-19 positivity rate is surging this winter, we're seeing that reflected across our staff, across our students, and the community as well. So we did have a little over 650 teachers out, 1,000 staff overall. That makes for quite the juggling act. And our central district administrators are pitching in, teaching in classrooms, but this has really been an hour by hour sometimes, and school by school assessment with each school
leader. The superintendent did that too. We just saw her in the video. She walked into school and walked into a classroom to teach a classroom during this week. So it's all hands on deck, right? Yeah, exactly.
So as a Boston Public School mother yourself, should remote learning be in the mix? How do you convince the governor that these days should be counted as part of the legally required 180 days of school?
We continue to be in conversation with the state, and as a mom with 2 young kids, I know that in-person learning is better for our young people. My boys, their eyes light up when they get to walk into that classroom. They're happy to be masked up. They're happy to have safety precautions. They just want to see and be there and be with their friends and teachers in person. But when we're at the point when staffing levels mean we are almost unable to keep certain schools open, we do have to then make that choice of whether we call it a snow day and have no programming at all for our students, regardless of the weather, or we allow for some remote flexibility, especially during this winter surge.
And these remote days should count as part of the legally required days?
I believe during a surge, when there are staffing issues that are driving these decisions, it is in the best interest of everyone to make sure that we have flexibility and we can keep everyone safe.
So let's talk about that. Snow kept kids home on Friday. So here's the question, there is remote learning infrastructure in place. why not have it on a snow day? If you can't go to class, why not continue remotely?
We do have to have some more preparations if we're going to do full on remote learning for our students. Some school by school administrators have already started dropping off the Chromebooks and laptops to students. That has happened at some of the schools that I'm familiar with. But across the district, there needs to be, again, in agreement and partnership with the state, a deeper conversation about how we can ensure that consistency and quality for our students.
Got that. I'd like to talk about masks now, because the teachers' unions are trying to push through a bill to mandate masks in the classroom until June 30th, which obviously is the end of the school calendar. And they want kids 2 years and older to be wearing them. Are you on board with that?
I am on board with that, and that will likely be the policy for the Boston Public Schools as well through the end of the year. We know that kids handle their masks very well. The teachers are great at making sure that everybody is reminded and knows how to manage lunch times and other play times and academic times. And so this is about making sure we can continue to contain transmission. Much of the COVID-19 cases have come from outside the classroom into the classroom. So we want to keep people safe in the classroom too.
Let's go back to vaccinations. You're requiring all city employees to be vaccinated in order to work beginning January 15th, which is in another week. What about booster shots? Are you going to mandate those as well?
So far, we are following the CDC guidelines, which have not yet reflected booster shots in the fully vaccinated definition, but we'll continue to evaluate as they evaluate as well.
And when do you think that, do you see that happening, though, sometime within the next school year or so? Within the next 5 or 6 months or so?
Our Boston Public Health Commission and many of our local public health officials are in very close contact with the federal decision makers. We have very close ties with those who are in charge at the CDC. So I know that we will stay in close communication with them, but we are also working to move forward with our own policies and set floors and build on that so that we can always be sure we are keeping our workforce and our residents safe.